Okay, that's good enough. Good enough. Good enough. Hi, good evening, everyone. Seeing you again. Okay, long distance friends. Today we talk about functional food and cardiovascular disease. Uh, I'm going to start with why we need functional food first. I have to apologize for some of you who are nutritionists because this slides may be too painful for you. To say that nutrition science is not science. Nutritional science is not science, sometimes it's religious. Okay, you believe in something in the textbook has no proof. For example, some guidelines so wrong they make people sick. Like low fat diet is good. You need to understand what fat is good fat, what is bad fat. You switch to soybean cooking instead of butter or trans fat. This is all nutritionist advice. And the high cholesterol diet, such as egg yolk, cause high blood cholesterol is now known that is wrong. Or drink more milk, prevent osteoporosis, and now that milk is acidic and it causes osteoporosis. And I think the 1, 2, 3, 4, 5 topics right now has been changed recently because now we know that nutritional textbook is not right. But the last thing is still remain, they keep saying that your diet provide enough vitamins and minerals, so you should not take any supplement. You should take drug and no supplement. This is so wrong and still wrong. Actually, if you take supplements like I do, you will not need drugs, okay? The problem about food that we eat today is not perfect. It gave us macronutrients, okay? Fat, carbohydrate, and proteins, and inadequate amount of micronutrients. So next time when you eat your food, ask yourself, is this fat, is this protein, is this carbohydrate? But it lacks micronutrients, and these micronutrients are functional food, okay? Don't worry, you will not have carbohydrate. For your energy, you have plenty. Proteins, we don't need enough, and fat, we definitely don't need that much at all. But what we need a lot is micronutrients. But what's wrong about food we're eating? It's manufactured, it's processed, and frozen. So it means the micronutrients are depleted in this food. Okay, when you grow plants in the soil, you get food from soil. It's soil grown vegetables. But now we eat plants that grow in water. It has nothing but insecticides and herbicides and fertilizer. So you are not eating food. You are eating fertilizer, insecticides, and herbicides, and you call them food. And you say these food provide enough vitamins. Okay, most food that is processed always have sugar added for the taste. So you always get refined carbohydrate, and I told you sugar is toxic. And food nowadays is high in omega-6. Part of it is because it's come from what we believe that butter and animal fat sometimes is bad. We switch it to omega-6. Actually, we have to switch it to omega-9 and 3, the one I told you before last week. It's low in micronutrients and probiotics. Why? Because we rush to process things. When I was young, you know, all of you love durians and mango from Thailand, right? You know, when I was young, we can have durian only once a year, mangoes once a year, because it takes time to grow these plants and then collect the fruit. But nowadays, because of the fertilizers, everything is rushing. You can have mangoes every month, every week, anytime you want to, because they grow them so quickly. So these food doesn't have enough time to absorb micronutrients from the ground up. So it micronutrients depleted. The study showed that organic food has more micronutrients than the manufactured food. And the problem is food nowadays, we don't do fresh food anymore. So it needs to be food preservative added. And it's high in sodium, phosphate, nitrates, and other stuff. We go back to like in the past when we eat only sausage and bacon, because in the past we don't have refrigerators. We want to kill this meat so we can keep it a long time. But nowadays we keep everything a long time and we put food preservatives with it, and it causes cancer. And food nowadays are acidic: sugar, soft drink, protein, fat, and reverse osmosis water. So this, admitted, this is what I'm eating, and even I try to avoid, and most of you are eating. Real food is the must, but it has to be unprocessed, fresh, clean, or even raw, like raw vegetables, right? Low temperature cookings. Hopefully it's organic, whole plant based, high fibers, grain, nuts, and don't forget olive oil or rice bran oil. But nowadays we eat only processed food. I know you've been taught that breakfast is good. Everyone must have breakfast, right? Your children must have breakfast. But you know, breakfast nowadays that we eat, like donut. I don't call donuts breakfast. I call it toxin because it's sugar. So when you eat donuts with coffee in the morning, I don't think we get any micronutrients. We only get sugar. We only get toxin. And on the right hand side, it's not food. It's artificial product that look like food. But it may make our stomach full, but it provides no micronutrients. And this is what we eat. So if you believe that you eat breakfast is good for you, systemic reviews show that more breakfast mean more fat. People get obese by eating breakfast because it's too much energy, and also because they don't eat real food anymore. I love to have breakfast if it's real food, okay, like congee with pork, or rice, chicken, rice soup, or fish rice soup. But I avoid not to eating this kind of sugar-filled breakfast because it's not good for my body. It's not breakfast. It's dangerous. It's toxic. Study shows that higher intake of ultra-processed food increase mortality risk. So advise people to have breakfast without caring what kind of breakfast they have. It means you're killing them. The study showed that ultra-processed food elevate risk of cardiovascular disease. Like in these studies in France, and French actually have a good food. But if you eat always packagings and ultra-processed food, you increase risk of cardiovascular disease because it contains omega-6, it contains insecticides, contains sugar, and it increases of cancer. So we need to switch the ideas of food has to be real. Food has to be real or something safe. And then the second thing that we believe that, okay, when you eat food, you get enough nutrients is a bad idea. Okay, the first idea that I show you, your food is synthetic. Food is not real food. So there's no way you can get all nutrients. And the second, even though you eat food, real food, nutrients come from different sources of food. It's impossible to eat complete meals every day. So people who say, oh, eat regular meals, get enough vitamins, I will ask them right away, tell me what kind of food contains vitamin A. If they can answer my questions, and then they say, okay, vitamin B, where to eat, what to eat. C, what to eat. D, can you eat sunshine? No way. E, F, fish oil. Q, CoQ10, lipoic acid, and all. And end up, most people, nutritionists who say that eating food get enough nutrients cannot answer my questions, because people who say so need to tell me zinc, where the food can find zinc. I can tell you everything. Zinc, C, E, D, fish oil, where to find them. If you want to eat complete meals, God, you have to eat a lot. Oh, we need to have fish from the oceans. You need to have a different colors, vegetables. What about probiotics? Oh, you need to have a stinky cheese or natto. And what about the sun? You have to eat your breakfast in the sun. Where is sunshine? Breakfast room, you have a sun. So it means that complete nutrients are impossible, okay? Unless you can tell me where to find B. B is found in grain. Grain and nuts contain B and E, okay? A, you need to eat carrots and pumpkins and all that. C, you need to have fresh, green, leafy vegetables. Okay, don't forget probiotics. You need to have a stinky cheese. You need to have natto as your breakfast, like Japanese people do. Otherwise, you don't get complete meals. So this is the one reason it's difficult to get complete meals, but I hope I will try. Okay, next year I'm gonna open a kitchen, it's called Lung Teng Kitchens. I will try to provide you with the complete meals. And nowadays we eat reverse osmosis water, not like the water in my hands here. Or reverse osmosis water contains minerals. How can you gonna get minerals? And then we eat hydroponic vegetables. They have no minerals in it. Food, fresh food contain more nutrients. We barely get fresh foods and we keep it frozen. If you taste the amount of nutrients when you keep it frozen, from time to time, if you freeze it for a year, the amount of nutrient will be less and less and less and less and less and less. And when you're older, you cannot chew vegetables. When people say, oh, eat regular food, they never care that old people eat only carbohydrate. And the problem, that's why getting all nutrients from your food is bad idea, because what we live is not true anymore. All right. And now I want to advise you, if you want to get a good food, complete, almost, let's say almost complete nutrients, follow this rule. First, good carbohydrate is grains. So not rice, grains. Switch your rice into, let's say cashew nuts, almond nuts, or corns on the cob. Second, have olive oil is a part of your dietary plan. So your food, you need to pour olive oil or rice bran oil in it. Less animal fat because it contains toxin and inflammations, not because of cholesterol. You can eat butter because it's less toxic. Okay, you can add butter, but don't forget to put olive oil in it. Eat fatty ocean fish. Eat egg yolk. Eat whole food. What kind of whole food? The food that you can eat as a whole thing. For example, mushroom, you can almost eat the whole thing. Pig, you cannot eat the whole pig, right? Chicken, you cannot eat the whole chicken. You don't eat their brain, you don't eat their skulls or anything. So this is not good, complete food. You need to eat small fish because you can eat the whole fish, or small shrimp, you can eat the whole small shrimp. Oh, what about insect? Yes, insect is complete food. Come to Thailand, I will invite you to have insect meals if you want to. All right, and don't forget to get minerals. You need to eat soil-grown vegetables and mineral water. So to teach people to eat food and get complete nutrients, this is your slice. Not just say, oh, eat your regular meals, you get complete diet anyway. It's impossible. You need to tell them what to eat. And even so, you try to do the almost complete nutritional guideline that I give you, you still need supplement because you cannot get vitamin D. So why we need supplements? First, like I said, we need micronutrients, vitamins and minerals, and there's no way we can get enough from our food. And the second, sometimes we need more. We need more antioxidants. I'm gonna show you soon about something called, not today, like astaxanthin. If you want to get astaxanthin from a regular ocean fish, you need to eat like 5 kilograms of salmon every day, which is not possible. So making micronutrients in the pills is easier. We need micronutrients to prevent diseases as an anti-aging medicine. And I like to tell you the term of functional food. Good food can be functional. It means act like drugs. For example, we know that coenzyme Q10 is good for the heart. You want coenzyme Q10 in the food? Eat beef heart. Oh God, you need to eat heart, you need to eat liver, or you need to eat brain to get coenzyme Q10. I prefer coenzyme Q10 in the capsule, right? It's easier. Baking soda for renal failure, melatonin for good sleep, vitamin D for cancer, high dose vitamin C for cancer as well, and N-acetylcysteine for reperfusion injury. So a lot of foods can act like functional food. For example, this one, I call it almost complete meal. But who can eat this one every day? All right, hopefully you can, I cannot. Start with the salads, start with grains. We choose corns, quinoas, and beans. It's called Greek salads. Vegetables like cucumbers, tomato, bell pepper, carrot, and beetroot, different colors. Olive oil, fruits instead of sugars, herbs, mushroom, tofu, eggs to provide some proteins, or you can add small amount of salmon's fine. And don't forget probiotics, stinky fermented cheese. So these are functional food. For all of us who live in Asia, I hope you're looking for spice. These spice, different colors of spice provide antioxidant, provide micronutrients, provide taste. There's a 3 Thai dishes. I know you try at least 1 or 2 of them, and I know you love it because it's the most famous Thai dishes of all. Massaman curry, shrimp tom yum soup, and som tam. Okay, I hope you come to visit at the Heat Anti-Aging Symposium in March if you have a chance and try spicy Thai food. Spicy food doesn't mean it's hot food. That doesn't burn your tongue. It's just full of taste. It's a mouth full of taste. It provides antioxidants. It provides micronutrients. Simple. It's called functional food. And the studies already show consume spicy food inverse risk of death. So example like gapao pork here with fried eggs here, som tam here, pad thai your favorites, and fish with a lot of spice on top. It's a part of Asian food. We are lucky. And you know that incidence of cancer is the lowest in Asia. Lowest in Asia. Garlic, for example. Add garlic into your food. It prevents cardiovascular disease. We call functional food. But people buy, I don't understand, people buy garlic in the capsule and take it, put it in your real food. Okay, Thai people always put garlic in our food. This one I love. When you have upper respiratory tract infections, the doctor prescribes antibiotics. Even though you know it's a viral infection, to me, when I have upper respiratory tract infections, I did sip the green tea with honey. Honey. So sugar is toxic, but honey during when you have common cold is good for you. The study shows that honey is better than drugs for improvement of URI symptoms. You see, even zinc lozenge is better than drugs. These are functional food. It used to treat us. What about curcumin? There's a lot of study curcumin. It reduces symptoms of knee osteoarthritis. It's good for cancer. It's part of the curry. You don't have to take curcumin in the capsule. If you want to eat spice Indian curry, a lot of food contain curcumin, including massaman curry. So I told you about functional food, the food that function. When people have mild hypertension and come to see me and say, doctors, my blood pressure is off and on, and when it's high, it's not that high. How can I avoid my high blood pressure? I cannot take drugs because it's too strong. I don't like drugs. Give them chelated magnesium. You'll be surprised. But you don't forget to treat them hyperuricemia though, uric. Hyperuricemia is a cause of hypertension. Check for the uric acid as well. And if you give them magnesium supplement, the blood pressure will come down, believe me. So I told you, try to find food that is functional food. Spice, spice, and spice. Mineral water, like what in my hand here, also the functional food, okay, because it contains minerals. Okay, food that is a soil-grown vegetables are functional food. But sometimes it's easier to eat food in the form of capsules, soft gels, and tablets. Vitamin D, for example. We know the vitamin D comes from the sun. In America, they say you can get vitamin D from milk and orange juice because they are fortified. They add vitamin D into packaged food. Don't think that the reason that we expose yourself to the sun, we live in the Southeast Asia, everyone has high level of vitamin D. You are wrong, and you'll be surprised. To prove it, test yourself vitamin D level. I used to test vitamin D level in my office from my coworkers. Only 3 of them have enough vitamin D level above 30. I'm not talking about 40 that we aim to be 40 nanograms per ml. Let's just ask about 30. You know, all of them, including these guys in my office right now, have low vitamin D level. 3 people who have enough vitamin D level. One is me because I took supplements all the time. Second is a messenger who always running himself in the sun. And the third is a cleaning lady who always cleaning something up front and outdoor. The rest of these people working in Thailand have low vitamin D level. So to expose to the sun to get enough vitamin D is not easy. And all the people, sometimes the body cannot make vitamin D very well. If you're not so sure, please test for vitamin D level and then replace them. We have vitamin D2 replacement called ergocalciferol and vitamin D3. I'm going to show you the data soon that vitamin D3 is much better. It can reduce mortality rate. So make sure the vitamin D you're taking is vitamin D3, not 2, okay? Why vitamin D is good? Not only is good for the bone because it increases calcium and phosphate absorptions, it prevents cancer, it decreases cellular proliferations, it's an immunomodulator. You know, studies just come out that people who got COVID-19 have low vitamin D. So why we are so worried and close the country down, all we have to do is give away vitamin D3 to prevent COVID, and life will go on. Let me tell you the story. In March this year, we set up the meeting called HEAT Symposiums in March. The COVID just arrived. We don't know what to do, but we decided the show must go on. We have the meeting, yes, but we tested everyone is safe from the COVID. However, I want to make sure that anybody who comes to my meeting in March get protections. I gave them free vitamin D3, 5,000 units a day. And so far I've heard none of them who visit my meeting in March had COVID-19 infections. Even so, they even tell me that their health feels better. They don't have any cold at all. They live in Philippines, they live in Thailand. Some of them come from Malaysia, Singapore, and Australia. None of them had COVID-19 after I provided them with free vitamin D supplements during my meeting, because vitamin D is so important for your immunity. It also inhibits renin synthesis, so it's good for hypertension, increased insulin production is required for diabetes, and increased myocardial contraction, which is good for your heart, right? So why we are vitamin D deficient, even though we exposed to the sun? Because look at my dress code here, I barely expose myself to the sun. And all of you know how old I am. I cannot look old, right? Otherwise you will not listen to my lecture. So I provide myself with the sunblock head to toe. So when I expose to the sun, I'm not afraid of getting melasma or anything because I have sunblock, good sunblock. But I also lack vitamin D from the sun. That's why I have to take supplement. Office worker, we don't have vitamin D. My case, there's called a sunblock. And older people, sometimes they cannot make vitamin D from their skin. And what happens if you have low vitamin D? So please have it test. First, all the studies in Thailand prove that hypovitamin D increase risk of death from all cause, infection, sepsis in critical ill patients, and also myocardial infarction. So talking about doing the medical checkup every year without testing for vitamin D, are you missing something? You want to know that in the future, you're going to develop cancer, heart disease. Look at your vitamin D level. This study is funny though. The title of these studies, if you read it, would say, vitamin D supplementations will not reduce or cause mortality. It's published in BMJ 2019 last year. And after these studies came out, people who oppose against the use of vitamin D and supplement come to me and say, you see, vitamin D supplement is not good. It doesn't reduce all-cause mortality. Dr. Patana, what are you going to say about it? I said, you should learn to read the book from the inside, not just read the title. They put this title in so it will be allowed to be published. But if you look the whole content, it say, first, look at the last paragraph. All-cause mortality was significantly lower in trials with vitamin D3, but not with the trials with vitamin D2. So when you put vitamin D3 and vitamin D2 study together, turns out it's not significant lowering all-cause mortality. But if you take a look at vitamin D3 alone, it's significantly lower mortality rate. You see, don't judge the book by its cover. Read the content of this. That's the first thing. And the second information this study provides is vitamin D3 supplementations significantly reduce the risk of cancer death by 16%. Don't read the paper just by the cover. It says it doesn't reduce risk of cancer. It doesn't reduce risk of anything if you use vitamin D2, but if you use vitamin D3, it lowers risk of death from everything, and the most important, cancer. I've tested my cancer patients. Almost all of them have very, very low vitamin D. And people who have COVID-19 infections, influenza always have low vitamin D3. So make sure you do yourself a favor. Test for your vitamin D3 level. If it's lower than 40, please find supplement. And supplement has to be in vitamin D3 form, because not only you prevent yourself from cancers, COVID-19, influenza infection, you will improve your cardiovascular health as well. So how we gonna get vitamin D3 supplement? For some of you who's so naturalist, purist, know this, go out in the sun naked 15 minutes every day. I think I allow my employees to go out naked in the sun if they want to, every day. But right now it's raining. They're not gonna get vitamin D3. Eat cod liver oil. I think the easiest one to take vitamin D3 supplement, or do some mixture of supplement that contain vitamin D. In Thailand, we have 1-hydroxy vitamin D3. In the future, and 21 and 25 dihydroxy vitamin D3. In the future, we will have 24-hydroxy vitamin D3. Whatever you do, check your vitamin D level. It should be higher than 40 nanogram per ml. So this is functional food for you. Now, I'm taking more than just vitamin D. I'm taking a lot of supplements. So how are you gonna take a lot of supplements? Like this, the whole hands filled with supplements. I take it with meals. It means I don't take it with empty stomach because it's less stomach irritations. So I take it with meals. My meal is not over. My vitamins is already inside, and then I complete my food. If you feel fresh with that vitamins, take it in the morning, such as vitamin B1. If you make you drowsiness, like give you drowsiness like melatonin 5-HTP, take it before bedtime. No need to have vitamin days off, because we need to provide our body with complete vitamins every day. Toxic accumulation, if you're smart enough, is unlikely. Just don't take iron, calcium, and vitamin A, because they provide the toxic accumulation. But most vitamin, if you have knowledge, is safe. Do not believe that lipid soluble vitamin are toxic, because sometimes some water soluble water, like vitamin C, if you take too much and you don't drink water, it causes oxalate stone. So to take vitamin, each individual vitamin has its own unique way of action. You need to understand. Side effect of supplement is little. For example, GERD, gastroesophageal reflux, prevent by taking your vitamins with meals. Another thing is expired materials. Fish oil, for example, you buy like a package of fish oil. Fish oil is not, you cannot keep fish oil at room temperatures for a long period of time. Keep it cold. Sometimes it contains heavy metals, contaminations, and sometimes it's just mild. For example, melatonin can cause headache and vivid dreams. If you reduce the dose, the side effect disappear. I talked to you before about vitamin D. I didn't mention about the side effect. Actually, if you take vitamin D oral form, the side effect is almost none. The side effect that is found is from the vitamin D injection. Okay, iron, I hate iron, it causes toxic hepatitis. Pregnenolone can cause high blood pressure and headache, and DHEA can cause oily skin and acne. So it's rare to get side effect from your supplement. Choose the supplement 1, 2, 3, 4 at a time. For the start, I already told you about vitamin D. So why we need to take supplements? I told you before, to prevent aging. Don't laugh at me. I've been taking this supplement for 20 years. And the past 20 years, I don't think I ever aged for the 20 years. So I know that the supplement works for me to prevent the aging force that I told you last week. Prevent oxidative stress, glycation end product, inflammation, toxin, acidosis, and stress. For example, for oxidative stress, I take resveratrol, I take astaxanthin, vitamin C, E, and coenzyme Q10. For glycation end products, I'm taking benfotiamine, pyridoxamine. Inflammation, I take digestive enzyme fish oil. For toxin, I take probiotics. And for acid, I take sodium bicarbonate. For the good sleep, I'm taking SAMe to prevent stress and melatonin. We have to go through one at a time, and we don't have enough times. So today I will focus on cardiovascular disease, which is a part of the aging syndromes that I talked about last week. Okay, the cardiovascular, the most common one pathology is atherosclerosis. It's the chronic inflammations in the wall of your arteries, coronary arteries. And then after inflammation, so inflammation comes first, and then oxidize LDL cholesterol with deposit in the macrophage, and then form the plaque, and then calcification will follow. And one day the platelet will decide to clog up, but the plaque is kind of break. So when the doctors give you only statins and antiplatelet, they will treat you from the right cause. And the right cause of atherosclerosis starts from inflammations. I told you last week how to reduce inflammations by changing the oil that you use to cook. Switch it to the rice bran oil or olive oil and take fish oil supplement. But doctors knows only one thing, drugs, and blame it on cholesterol. The reason because the plaque containing cholesterol. And some studies show that super high blood cholesterol is really have a increased risk of coronary heart disease. So they start, and also the last important thing, because they have the drug that reduce cholesterol, and some small studies shows that it can reduce cardiovascular event in the group of patients who have a super high risk. So they believe this is a good drug. There's someone even call it an anti-aging drugs. There's no such thing anti-aging drugs. So they starting giving statin to everybody. So we need to understand statin a little bit, because I have to ask all of you in this room, once in your lifetime, in your upcoming future, you will be asked yourself, or someone will ask you to take statin drug. Will your answer will be yes or no? To me, I think I say both, okay? Right now, I say no to statin because I don't think my risk is high enough to take statin. But in the futures, in the times, if I think I have enough risk to take statin, I might. But I believe with my anti-aging protocols, with the supplement I'm taking, I can stay from statin for the rest of my life, okay? So statin inhibits HMG-CoA reductase, so it reduces cholesterol effectively. During this process, it will reduce coenzyme Q10, So people who take statin should be recommended to take coenzyme Q10. And because it can prevent coronary event in the high-risk people and reduce mortality in the high-risk people, statin is a good drug for the high-risk patients who already have heart attack, angina pectoris, or stroke. But it's a bad drug if we use it for everyone, like girls, young ladies, and even old ladies. I'm going to show you soon that statins can cause harm than good. The second problem with our statin is most of them don't know. By increasing the dosage, the company want to sell high amount of statin, push it to the maximum dosage. But increase the dosage, statin, doubling the dosage will be increase the effectiveness by only 6%, but the side effect will increase 100 times. And what are the side effects of statin? Do you know statin causes diabetes, liver damage, rhabdomyolysis and heart failure, steroid hormone depletions, and adrenal fatigue? But the problem with statin will come when you take other drugs in combination. The most common I found is when you're taking statin and one day you went to the dermatologist and they prescribe antifungal drug, and suddenly statin cannot be metabolized and the level of statin will go 20 times more, and the toxicity will happen. The patient will develop severe muscle pain and end up receiving dialysis. The other things I found is statin with the fibrates. Both reduce blood lipid. Okay, statin reduce cholesterol, fibrate reduce triglycerides, and many cardiologists love to prescribe them together, and seeing the patient's creatinine rising, and after the patient receive dialysis treatment for life. Who done it? The cardiologist did. So be careful when you prescribe statin with omeprazole as well. This is the samples of the wrong and malpractice use of statin. The patient is 42 years old. Of course, she's young. She loves to do a lot of blood tests because she thinks about healthy things all the time. She exercises. Her HDL is high, but her high blood cholesterol is come from HDL. The doctor don't test for HDL just because she have a total high blood cholesterol, because she's a kind of stressful person. The doctor prescribes simvastatin right away as a high dose. And then suddenly she developed calf pain and cramp. It's so common. Statin and cramp is so common. I think it's over 50%, but you don't ask, that's why you don't know. And instead of doctor try to switch statin, stop statin, because there's no indication for her to receive statin in the first place, the doctor prescribed NSAID instead and muscle relaxant. So from the lady's healthy one who doesn't need any one drug, now she have 3 drugs. What happens when you take NSAID for a long time? Of course, she have GI upset, so she has to spend money for the gastroscope. And then the doctor prescribed proton pump inhibitors, and doctor who prescribed them didn't know that proton pump inhibitor cause kidney failure. So you have statin that increase of kidney failures, you have NSAID that increase of kidney failure, you have proton pump inhibitors that increases of kidney failures. 3 drugs. What happened? And eventually she came to see me and she had kidney failure, crying. I tell her it's easy, just stop all the drugs. And she stopped. She became healthy again. And right now, even her blood cholesterol is normal because I teach her to reduce stress. Stress is the cause of hypercholesterolemia, and you cannot treat hypercholesterolemia with statin. Mr. Cardiologist, please listen. This is a 2 example. I have so many examples from my patients. I learn from them as well. I try to treat them. This guy came to see me last year. He's 62 years old man. He has diabetes for 10 years. He's been taking metformin, and I don't know why right now, anytime when someone has diabetes, the doctor will force them to take statin and force them to have LDL cholesterol lower than 100 milligram percent, even though they have no symptom or anything. And you see, if statin works, okay, this guy been taking super maximum dose of simvastatin for the past 10 years, and during the past 10 years, he received balloon angioplasty 5 times talking about the failure of statin, and doctors still prescribe them. He's so stressful, and one day he just eat too much carbohydrate, so his triglyceride so goes up. And they'll say, oh, your triglyceride go up. We need to add phenolfibrate. I told you before, statin plus phenolfibrate means statin level cannot be metabolized, and statin level in the blood will goes up skyrocket. And for the past 2 years, the patient see his creatinine rising. By the time he saw me, he said, help me, doctors. Someone told me that you are the best nephrologist in Thailand. Right now, my creatinine level is 2.4. I stopped both statin and fibrate. Within 1 month, his creatinine level 2.4 comes out to 1.4. And right now, he has normal creatinine level. So I restart statin. I use rosuvastatin for him twice a week without phenolfibrate. To control blood triglyceride, I use fish oil and ask him to cut down carbohydrate. Think about saving people from dialysis machine by just stopping use bad drug combination. I've done it all the time. Cardiologists don't know about statin side effect, and they don't understand statin pleiotropic effect. You know, if you think the cholesterol is a culprit for atherosclerosis, how come only statin only is the one drug that reduces cholesterol and reduce mortality? You use phenolfibrate, cholesterol coming down a little bit, but it will not reduce mortality. Niacin will not reduce mortality, cholestyramine and all other cholesterol lowering agent will not reduce mortality. The answer is cholesterol is a bad culprit. The good culprit and the effect of statin is because statin inhibit inflammation, and not every statin inhibit inflammation. Actually, statins, only 2 kinds of statin has been proved to reduce inflammation and prevent heart diseases: atorvastatin or Lipitor, and rosuvastatin and Crestor. So I don't any other statin. I don't prescribe simvastatin. I only prescribe atorvastatin and rosuvastatin. I will not, and I prescribe them every other day. We call alternate day dosing of statin. I will show you the study soon. But let me tell you about aging healthy people. Right now, when you are over 50 or 60 years old, the doctor will force you to take statin. I believe a lot of people in this room are taking statin without any reason, but actually statin doesn't support at all for primary prevention in healthy elderly people. There's no relationship between LDL and mortality in elderly. Let me take it back, it's not no relationship. It has inverse relationship. It means if you keep your LDL low in the elderly, they will die sooner. Elderly people need higher LDL. And one thing, especially in women who have low cholesterol, we have a chance to receive a bleeding stroke. Talking about killing your wife by giving statin so they have a bleeding stroke. Good luck to you. Maybe that's your plan, I don't know. But if you love your wife, don't give them statin because chance they can have a bleeding stroke. So if you want to control blood cholesterol, be realistic. Okay, LDL goal actually is 160 the most, not 100. 100 is for people who already have a heart attack, who have a stent, who have a stroke or something. But in healthy elderly people, keep the LDL 160. So if you want to prescribe statin for that reason, or people who already have stroke, what I did, you have to understand there's 3 types of statin: low potency, intermediate potency, and lipid soluble high potency. High potency means it's reduced blood cholesterol better, and the good things about high potency statin, atorvastatin and rosuvastatin, is it reduces inflammation. So if I think my patients have higher risk of developing stroke or heart disease, I will prescribe atorvastatin alternate day, or rosuvastatin alternate, actually every 2 days. Also mean 1 day and then break for 2 days and the other days. And they found that my patient has still controlled blood cholesterol very well, even though they don't take atorvastatin every day, even though they don't take rosuvastatin every day, alternate day will save them. So if, in case they just accidentally take other drugs, the level of statin that accumulate, at least you have 1 day break. Okay, so I recommend my patients to take alternate day statin only if they have indications for taking statins. So I prescribe atorvastatin alternate day, rosuvastatin alternate day. I don't prescribe simvastatin. You cannot do simvastatin alternate day. The potency is not high enough to do it in alternate day. And you know what? Simvastatin reduces blood cholesterol, right? But it never showed that it can reduce mortality rate. I showed you before taking high dose simvastatin for 10 years and receive balloon angioplasty 5 times. And you're gonna see it often. If you keep prescribe simvastatin, you will fail your patients. Is that what you want to be? Failure doctors? I don't think so. So if you think the patient have indication to receive statin, high risk for stroke, high risk for heart disease, atorvastatin or rosuvastatin alternate is good. What about low potency statin? These statins are good because it's safe. It's safe, but it doesn't reduce heart disease. So I use it for people who so health concerns, they don't want the cholesterol to be too high, and they're young, they don't have any other risk. I will prescribe them mevalotin, but if they want something natural products, I will prescribe red yeast rice. So this is a study I'm talking about, non-daily statin dosings, and it showed it can control blood cholesterol as well as everyday dosing, but with the half side effect. But it has to be rosuvastatin or atorvastatin only. So when you do something like alternate day and some other cardiologists say, you cannot do that, show them it's called PRADA studies. Okay, it's a brand name, right? PRADA study. So should we prescribe statin? Yes, if the patients show that they already have severe and high risk of having myocardial ischemia and stroke. You cannot judge by just LDL number because the risk of statin is too high. If you prescribe statin, don't forget to prescribe coenzyme Q10. And in my practice, I only prescribe statin to high-risk patients, only use atorvastatin every other day or rosuvastatin twice a week, okay? So if the patient is so worried about the blood cholesterol and don't want to take statins, first, check if they're taking artificial fat, trans fat. Tell them to do caloric restrictions, exercise, reduce sugar, reduce saturated fat, and don't forget to reduce stress. Make sure they have a sleeping good night's sleep. But there's 2 supplements I'm going to show you that it can reduce cholesterol. First is rice bran oil, which is a part of the cooking program. The second is stanol or sterol, and the third is a red yeast rice. It's turned out that I'm taking rice bran oil as a part of my food every day, and it can reduce this lipidemia. The second one is called, actually it's a hearty benical. Plant stanol is made from Finland. The structures look like animal cholesterol, so it's plant cholesterol look alike and interfere with cholesterol absorptions. Taking every day, it can reduce blood cholesterol by 15%. Okay, so the left one is a brand in Thailand. We call it hearty benical. The middle one is you can find in Europe. Okay, it can be smoothie benical or butter benical that's in America, or even the capsule supplementation. So for some of you so worried about your blood cholesterol, this is a safe way to reduce your blood cholesterol by taking plant stanol or sterol. You want more than that. It can be combined with something called red yeast rice. Actually, red yeast rice is a low potency statin. It's called lovastatin, but the studies show that it can reduce blood cholesterol by 20%, and it doesn't cause any kidney failure, myopathies, or cramp or anything. The problem is quite expensive and sometimes it's hard to find. But if you come to Thailand, I show you where to buy red yeast rice. Pharmadon has it. It's called statiquinone. Still, if you take red yeast rice, you still need to take coenzyme Q10. Okay. I told you how to prescribe statin. But then you say, so how can I know that they have the risk to take statin? You need to ask from history of stroke or ischemic heart disease. If they do have that, then you give statin, okay, Atova every other day, rosuvastatin maybe twice a week. Lifestyle, especially smoking, lipid profile, you need to compare LDL and HDL to be at least higher than 3. Metabolic syndrome markers such as A1C, uric blood pressure, inflammatory marker is maybe too expensive for you guys, don't have to do it. Homocysteine. But the one I use the most, the one I always use to make decision if the patient needs statin or not, is called calcium score or coronary artery calcification. It's a CT scan program. You put the patient in a CT scan, it will measure the level of calcified plaques in your artery. So directly seeing that, okay, the amount of calcium deposited in the coronary artery increase the risk of heart disease, just like in these pictures. So to me, if the patient calcium score is higher than 400 Agatston score, I will give them statin, okay, rosuvastatin twice a week. But okay, if they have something lower than 400, I'm going to tell you later about supplement, but I follow. If the first year the calcium score is only 8, next year 100, next year 200, I will not wait until they have a heart attack, will start statin. The problem is statin will not reduce coronary calcium score. Let me repeat. Statin stabilize plaques, so the calcium score will remain forever. Statin will not reduce calcium score, okay? Because it stabilizes plaque. To reduce calcium score, you have to use something else. What? First, quit smoking, cut down red meat, use alkali diet, low inflammation diet. I talked to you about it last week. Don't use warfarin in any case. Don't use warfarin. Take vitamin K2 and magnesium. What is vitamin K2? You know, vitamin K that we eat come from vegetables, and then the bacteria in our guts. The bacteria, the good bacteria, will switch vitamin K1 to vitamin K2, and the vitamin K2 is important for a protein called osteocalcin and osteopontin. Osteocalcin, the functions in the blood to move the calcified plaque, the calcium from your soft tissue and back to the bone. So talking about strong bone and good heart, vitamin K2. And also is important for osteopontin, which is the protein that prevents kidney stone. And talking about prevent kidney stone, remove calcified plaque from the heart. So, and also remove calcified stone. We talk about good heart, good kidney, and good bone with vitamin K2. What kind of food contains vitamin K2? Of course, I told you it's a bacteria that make it from vegetables. So any fermented bacteria, fermented vegetables. In Japan, we have natto, right? I think in Taiwan, we have a similar kind of fermented soy or something. And then in Indonesia, you have tempeh, but you're not supposed to cook it too much. So you have tempeh, you have natto, you have fermented soy bean, but not yogurt. Why? Because yogurt milk doesn't contain K1. You put bacteria in yogurt, you're not going to get K2. You want to get K2, you have to put stinky cheese with your salad. Salad has K1, eat it with the feta cheese. The bacteria in feta cheese will make K2 for you. So that's how you get vitamin K2. But for me, I take it as a supplement, okay? The study shows that natto or fermented soy lower risk for death. It's my favorite functional food. So this is a good functional food that's good for your heart. So that's why Japanese people live so long, but only women, you know, why Japanese men die young? Because they smoke a lot of cigarettes. Even though they eat natto, they eat fermented soy, but they smoke a lot of cigarettes, they drink a lot of alcohol, and they're super, super stressful. So, but Japanese ladies, they live longer, they take fermented oil, they don't smoke cigarettes, they don't drink a lot of alcohol, and they're not too stressful. And also, within natto, not only it contains high amount of vitamin K2, it also contains enzymes natto kinase. You know, when you have stroke, when you have a heart attack, the doctor will inject something called streptokinase. It's no longer streptokinase, it's artificial things, synthetic kinase, to lysis your heart. Why you need to do that? You just eat your natto every day to obtain natto kinase. Okay, natto kinase is a plasminogen activator inhibitors, and it can reduce calcium score. It can reduce calcified intimate thickness of your heart. So talking about perfect functional food for your heart, natto, natto, natto. Another thing I like you to consider is called magnesium. Magnesium has been shown to counteract vascular calcification. I told you that magnesium reduces blood pressure and it prevents vascular calcification. So go out and then find magnesium supplementations. You love food, you need to find avocado, cashew nuts, grains, pumpkin seeds, and almonds, and even bananas. But to me, to make it easy, I take magnesium supplement. If it's not good enough to prevent atherosclerosis, I have to tell you, we need to start thinking outside these box. That is me in the past. Such a good student, put myself in the box and never learned anything else. 40 years ago, I believed that eating egg yolk would cause high blood cholesterol. But now I throw the box away and I realize that eating diet with high cholesterol content has little impact with the cholesterol levels in the body. So enjoy your egg yolk because it contains enough vitamins. Time and time again, the study shows that egg consumption is not associated with the risk of cardiovascular disease. I talked to you about trans fat before. I talked to you about coenzyme Q10 before. You're so afraid of cholesterol. Please know the fact. Cholesterol that damages your heart is oxidized cholesterol. It's not just a regular cholesterol, it's oxidized cholesterol. And it's one supplement that can prevent oxidized LDL. It's called coenzyme Q10. The study shows that coenzyme Q10 can protect against LDL peroxidations. When we are over 40 years old, our coenzyme Q10 level coming down. We can make coenzyme Q10 from amino acid called tyrosine, but we need same E, S-adenosine methionine too. And when we older, we don't have enough S-adenosine methionine. And moreover, our organ is getting aged. And when doctor prescribes statin, then the coenzyme Q10 cannot be made at all because it also requires farnesyl pyrophosphate. So when you prescribe coenzyme Q10 in patients who already have heart disease and taking statin, I'm not surprised that so many studies show that coenzyme Q10 improve condition of congestive heart failure. Talking about functional food. So coenzyme Q10 is my favorite antioxidant. It prevents mitochondrial damage and also good for the heart and the brain. One last thing you need to know and always know, actually initial thing. I told you before, atherosclerosis is an inflammation disease. So when people focus on cholesterol, they miss the right stories of atherosclerosis. The true cause of atherosclerosis is inflammation. So by switching high cholesterol saturated fat with omega-6 fatty acid, does it improve clinical outcome and actually make things worse? So nutritionists, okay, I told you I apologize to all nutritionists who listen to this talk, but the nutritionist advice for the past 50 years have killed us all. Increased incidence of heart disease because omega-6 cause inflammations. Cholesterol has nothing to do with it. You need to understand there's 3 types of unsaturated fat, 3, 6, and 9. 6 is bad, 3 and 9 are good. 6 is bad, 3 and 9 are good. So we need to know the oil that you use contain 6 too much or not. For example, corn oil, soybean oil, and animal source such as meat, fat, and milk. Milk contains arachidonic acid. Drinking too much milk can cause cardiovascular disease as well as the animal source and well as the omega-6 oil. So you can switch the butter into the trans fat, it's getting worse. You can switch your cooking oil into corn oil, it's getting worse. It provides omega-6 and cause inflammations. You need to provide yourself with omega-9 such as olive oil and omega-3, that is fish oil. Fish oil, especially EPA, I showed you before, the level of EPA reflects the good aging. Okay, it means you don't age. If you have high level of EPA, when you buy fish oil, see the content of EPA plus DHA should be at least 6 to 10. For example, in Thailand, we have omega daily, omega cardi, and omega DHA and omacol. I don't buy the regular fish oil because the amount and content of DHA and EPA is too low. Studies called PUFA in the GISI trial by the doctor named GISI, by the way, come from Italy, have been shown for a long time that fish oil can prevent heart failure. However, the new studies shows otherwise. Why? Because look at these studies. First, it's done in the period of statin. These patients are very sick patients, already have statin, so adding fish oil may not help. The second, to prevent the patients with the olive oil in this study, turns out that they use placebo, that is olive oil. So these are fake studies. Agatston studies is fake study. Compare fish oil with olive oil. Olive oil is not placebo because it also reduces heart disease. Still, fish oil is better than olive oil in this study, but both are good. Still, American Heart Association still recommend that people eat fish oil. Okay, that's what they call it. Fish ocean, fatty ocean fish. You cannot find fatty ocean fish anymore because fish that you buy nowadays come from a farm. It's a farm-raised fish. It's not ocean fish anymore. So go ahead and buy fish oil instead. To buy fish oil, you need to know practical point. First, fish oil has more double bonds, so it means it can get oxidations and damage that we call rancid easily. The company will add vitamin E. So make sure on the side it says vitamin E to prevent rancid. Don't buy fish oil like a large amount. And in Thailand, you need to keep fish oil in the refrigerator because the temperature is so hot out there. If you keep fish oil outside, it will go rancid. And rancid and decay and bad fish oil can cause hepatitis because it's bad oil. And if fish oil gone bad, throw it away. If it smells stinky, throw it away. Okay. If you eat too much fish oil without omega-6 at all, like you don't eat fried food at all, you don't have any omega-6 at all, you barely eat any fat and take only fish oil, that can increase the risk of hemorrhage. So you have to be in balance between 6 and 3, which is ratio should be about 4 to 1. DHA required during pregnancy, but EPA may increase risk of abortions and bleeding. So for pregnant ladies, I recommend them to take fish oil during the 2nd trimester. Okay. And don't forget good oil is called MUFA, mono unsaturated fat that come from olive oil. It contains oleic acid. Olive oil can tolerate heat up to 240 degrees Celsius because it also contains palmitic acid. So it's a saturated fat as well. So it can tolerate heat. You can use olive oil for a light cooking. And it's been shown that Mediterranean taste diet can reduce cardiovascular disease and all risk of mortality. So they are my favorite oil. I have in my kitchen. I make salad out of it. I have olive oil just about almost every day. So you see, it's not just statin and antiplatelet to treat heart disease. You need to integrate everything together. You need to tell patients to quit smoking. You need to tell patients that sugar is toxin. You need to tell them about how to choose the oil for cooking. use olive oil, use rice bran oil, and avoid soybean oil. If you want to put milk in the coffee, fine, but let's not drink too much milk and dairy products every day, because too much animal fats mean inflammations. Okay, they need to take fish oil supplement and avoid fake butter that we call margarine. If you want to eat butter, eat real butter. Okay, avoid trans fat. Good supplements for atherosclerosis. Okay, I told you you want it come to food, natto, and natto. Because it contains natto kinase and vitamin K2. I have a natto kinase extract. I have vitamin K2 supplements. Okay, come to Thailand and I show you. I also take magnesium supplement, vitamin C supplement, coenzyme Q10 supplement. I don't take calcium supplement at all. In men, if you take too much calcium supplement, you will have heart disease because the calcium, you don't have a weak bone, calcium will deposit in your arteries and you will have calcified plaque build up. People who take a lot of calcium supplement in men will show to have high coronary calcification. And don't forget chelation, which is not my topic, somebody else topic. Okay, they will talk about chelation and atherosclerosis. You need to be holistic. When we talk about holistic, it means it's not about supplement. It's only about food, exercise. It's about body and mind. You know, when the mind leading, the body follows. Sometimes you feel sick just because it's so stressful. Holistics come from diet, lifestyle, exercise, supplement, detoxifications. My topic is not about hormonal replacement. Yes, sometimes you need medication, but not all the time. But the last thing is so important is called stress management. Exercise is so important. Walking at least 4,400 steps per day, improve survival in older women. This takes about 30 minutes. So, but if they're super old, it could take about an hour. Usually in 1 hour, you should be able to walk about 10,000. If you can do 1 hour walking outdoor per day, you will live longer. And you know, walking alone reduces stress because you have time to think about something else instead of watching only television programs, bad television program, listen to only the COVID-19 story. It causes stress, and stress reduces immunity, and you can get infected easier, and also cancer, gastric ulcer, weight gain, aging, depression, hypertension, cardiovascular disease. So stress is the cause of all disease. So many studies show that stress disorder related with the risk of cardiovascular disease. So when we talk about holistic treatment, have your doctors ever asked or determined the patient's stress? Please do so. We have so many supplements to talk about. Today, I only give you the examples of supplements of functional food with cardiovascular disease. But actually, we have supplements for all kinds of disease. Hypertension, we have potassium, magnesium. Dyslipidemia, we have plant stanol, we have red yeast rice. Atherosclerosis, we have fish oil, CoQ10, vitamin K2, magnesium, and don't forget natto. Heart failure, we have CoQ10. Adrenal fatigue, we have vitamin B, CoQ10. Liver disease, don't forget vitamin D, B, and E. Autoimmune, vitamin D, and probiotics. Cancer, vitamin D, arabinoxalan, which is one of the glucans to stimulate immune response. Eye problem and skin disease, we have astaxanthin. Stress, we have SAM-E5-HTP. Insomnia, we have melatonin. Diabetes, we have benfotiamine, pyridoxamine. CKD, kidney disease, we have sodamine or sodium bicarbonate. You see, by taking these supplements, what do I take? I think I take every one of them because I want to prevent all of these diseases. It's like functional food to me. It's like functional food to my patients. And here is my proof. I have patients who live longer. I have the oldest patients in the hospital. These 6 are the only samples of them, 7 of them. One of them just passed away last here at the age of 100 years old because her daughter decided to take her to enjoy ice snow at 100 years old in Japan, and she came back, developed pneumonia, and passed away. But she enjoyed herself and life until 100 years old. And all of them are taking less number of drugs, but they're taking supplements that I like to call functional food. You want to know more how can I combine them? Please visit heatantiaging.com. Look for the details of NCD course, International Online Course. We have part A and part B, or you can use heatantiaging.thinkific.com. We switch into part A and part B, and I hope to see all of you during our symposium in the March 11 and 12 in Bangkok, Thailand. The topic will be food and toxin. And if you cannot be here in Bangkok with us for any reason, we will provide Zoom meeting for you as well. Thank you so much. ขอบคุณมากครับ
Thank you so much, Doc. For March, did you say that you will give the Zoom recording for March if we cannot go there?
Sorry, sir, we can't hear you. What was that?
Do I get it right that you say that if we cannot come in March, you will give us the Zoom anyway if we register or not?
The answer is yes.
Okay.
If you come in March, I know you visit my symposiums, my meeting before. It's fun, it's enjoyable, it's filled with food, real food.
Yeah.
And in August, we will have a show as well. But if you cannot come in March, if the situation is not getting clear up yet, we will provide you with the online course, online live. Okay, don't worry about it. Okay.
Yeah.
And
okay.
Or sometimes you don't want to buy online, we will have the seminars that put in the package and send to you later. So you can still be able to purchase something that is not live, okay, in March about food and toxic. Yes.
Yeah. Okay. Thank you. All right. For sure, the August one, I will be there.
Yes, but if you can be here in Bangkok, you don't want to miss it. Only twice a year to enjoy yourself in Bangkok, right?
Yeah. 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 Thank you, Doc.
Yes.
Brett, are you going to read out the question
you have questions,
again?
Right? Okay, Brett gonna show me the questions, and I'm gonna repeat the questions and then start answering. It's all live though. Yeah. All right, the first question is, regarding acidosis in aging related to GI tract and blood pH, should we check plasma osmolality or should we check from urine pH and saliva pH? The answer is the blood pH will not change. We keep the blood pH constant. Okay, osmolality will not change. It will not change at all because the kidney will adapt it. So if you want to check the acidic of your body, you need to look at your urine pH because that's how you adapt it. The blood plasma pH will not change unless you dying, okay? It's the urine pH, so that's the answer. The second question is how to rejuvenate gastric flow, blood flow productions. Okay, actually enzymes come from pancreas. Besides probiotic, what supplement and nutritional do you suggest? Okay, in Thailand, and actually can contact the Heat Anti-Aging if you want to buy this one, because we have a company called Works, and we can send a supplement to your country. Okay, I use digestive enzyme. It's good, okay? We have to admit that when we older, when we eat too much, we cannot digest our food. It's the reason that sometimes when we eat too much food, especially if it's contain grains and vegetables, like what I recommended. When you eat too much grains and vegetables, we are not cows. We cannot digest grass. So admit it, we don't digest vegetables very well, and it causes our stomach to be bloating. Easy. Give yourself good digestive enzyme. Digestive enzyme should be a different topic because it's also reduce inflammation. However, Sometimes the digestive enzyme that the pharmaceutical company made for us contain only amylase, lipase, and protease. Digest three things that we don't need to be digested: proteins, carbohydrate, and fat. We can digest all these three very well, thank you. But what we cannot digest are fibers from plants, from vegetables, and grains like pectins. And also we cannot digest lactose from dairy product, and it causes lactose intolerance and leaky gut, right? So the good enzyme need to contain something that can digest pectins called pectinase, something that can digest fibers, okay? Something that can digest milk that's called lactase. And if you come to Thailand, you can purchase those digestive enzymes. In your country, if you want to buy digestive enzyme, I think you have a company called Transformation. Look at them. Make sure your digestive enzyme can contain bromelain, okay, and papaya, something from papaya, something from pineapples, something that can digest vegetables, and also lactase that can digest lactose from milk. Okay, so besides probiotics, I recommend digestive enzyme. The next question, in my experience, what is the maximum dose of astaxanthin to take? It depends. If you want the fast effect, you can take 16 milligrams. I don't recommend it, but don't take 16 milligrams for a long time because your skin will look like salmon. And when I take your skin, it looks like salmon. Doesn't mean it looks delicious. It looks funny. You don't want the skin to look like salmon, orange color, right? You don't want the skin to look like flamingo birds. So if you want to take one fast effect about the eye and the skin, you can take 16 milligrams for 8 weeks. And then you can go down to only 4 or 6 milligrams a day. Don't do maximum dose a long time. Otherwise, you will look like Mr. Flamingo bird. Okay. Okay, 4 milligrams or 6 milligrams a day as a maintenance dose. The next question is, what is your approach with someone who has, they have 3 patients, or 1 patient. Okay, the first patient, high ferritin, but less than 1,000, and then COVID-19. People who have high ferritin, it's possible they're taking iron supplement. They need to stop. People who have high ferritin, if they don't take iron supplement, it means the body absorbs iron badly. They found them in the patient who have thalassemia. So in that case, they may need deferoxamine. They need chelate. They have to chelate iron. By the way, EDTA that you use can chelate iron as well, okay? But if you want specific for iron, find something called deferoxamine. So if the patient has high ferritin and have the history of taking iron supplement, they have to stop, okay? If they are pale anemia, you may use something called erythropoietin that can switch the iron storage into blood, okay? But if they have high ferritin, high hematocrit, and super high and hepatitis, please consider chelations to remove iron out, okay? Especially they have hepatitis. Okay, second patients that they're asking me, my approach, 15 years ago, low ferritin with lupus nephritis, taking vitamin D3, irons and NAC, okay? Usually you don't have to worry about ferritin level. Ferritin measure the iron storage, but also measure inflammation. People who have inflammation will have higher ferritin, even though iron storage is not that much. If you think about iron storage, you may have to look at the TIBC, total iron binding capacity as well, besides and serum iron. So for these patients, 15 years ago, low ferritin with lupus nephritis, you take vitamin D, which is good. You need probiotics, okay? And I don't know if you think ferritin is too high, because I don't know the unit that you use in your country, but to me 5.2 is low, okay? So if they have low ferritin and they don't have anemia, don't worry about it. You don't have to do anything, okay? And she take vitamin D3, good. Vitamin omega-3 is good. But people who have autoimmune disease, you need to treat their gut. I will give these ladies, this girl with lupus nephritis, probiotics, digestive enzyme, and have something called berberine, which is the enzyme that help cleaning their gut. Okay, so I would treat them as they have a gut dysbiosis, leaky gut syndrome. I always treat gut when the patients have autoimmune disease. The question about the third patients, oh, it's not multi, oh, that's okay. Okay, next question. What is my indications to take pregnenolone? Actually, what is my indication to give my patients pregnenolone? Do I test the patient's pregnenolone first, or how many doses of pregnenolone and blind? Okay, I barely use pregnenolone. People who need pregnenolone are people who have severe adrenal fatigue, okay? And usually you can test the blood pregnenolone, but in Thailand, the test for pregnenolone is extremely expensive. But the cheap one to test for adrenal fatigue is called DHEA. Okay, so if I think that my patients have adrenal fatigue, I test for DHEA instead. And if DHEA is low, doesn't mean I'm going to start prescribing DHEA. I'm not going to prescribe pregnenolone. I'm going to start by the cause. The most common cause of adrenal fatigue is statin. Yes, the most common cause of adrenal fatigue is drug and statin. I would adjust the dose of statin, reduce the dosage. If there's no indication of using it, I will stop. And the next cause of adrenal fatigue is stress. So I treat the stress. To improve adrenal gland activities, I use vitamin B active forms and also coenzyme Q10. You see, I haven't touched DHEA and pregnenolone yet. I only use pregnenolone in case the patient have a low blood pressures and want to urinate all the time because they have super low aldosterone. Then I think that I need pregnenolone. Why? Pregnenolone can increase blood pressures and give patient headache. So if I give them CoQ10, reduce the dose of statin and vitamin B, good vitamin B, and support the stress, and the patient's getting better, I don't need pregnenolone. And sometimes their DHEA levels come up eventually. I don't need DHEA either. But if the patients have low blood pressure, I would ask them to drink mineral water all the time. They crave for salty food. It's time to prescribe pregnenolone. Why I don't prescribe pregnenolone all the time? Pregnenolone can increase blood pressure. So if you prescribe pregnenolone in the patients who have high blood pressures already, it's not good. And some people who have stress tend to have high blood pressure. I prescribe magnesium. But if you have low blood pressure, I cannot prescribe magnesium. I will consider pregnenolone. The dose is about 25 to 50 milligrams a day, 50 milligrams a day should be enough. DHEA, I barely use it. DHEA I don't use for adrenal fatigue. I use it for older ladies who refuse to use hormone and weak bone osteoporosis is very good. Older people with frailties, I use DHEA. And the second indication I love DHEA is to correct super dry skin. You know, older people, when they're taking DHEA, they were happy. They have acne again. I know you're not happy when you have acne when you were young, but when you are 80 years old, you see acne, you feel, oh, I'm young again. My skin glowing because it has some moist on it. So right now I prescribe DHEA, not because I have low DHEA. Unless, okay, I have prescribed DHEA in fatigue sometimes. It helps them with the sleeping, with the stress, but I usually prescribe them to prevent sarcopenia, osteoporosis, and also dry skin. All right, you asked about pregnenolone and answer DHEA. How many milligrams of iron can be taken before it becomes toxic? I don't know. I barely prescribe iron. And if I prescribe iron, it has to be short period of time. I need to know that patients really don't develop constipations. And usually what I'm using as an iron is I ask my patients to eat egg yolk, liver, and blood. You know, in Thailand, you can eat blood. pig blood, dark blood. So I barely prescribe iron, but the dosage I use only 1 tablet, regular 200 milligrams a day. Okay, the next question is how many milligrams of benfotiamine as dosage for AG and pyridox, actually pyridoxamine. I usually use as 50 milligrams. You can use higher dose, but it's gonna be super expensive. It's the most expensive vitamin B in the world, pyridoxamine and benfotiamine. Myconine put them together with all other Bs. We call it active B, contain benfotiamine, pyridoxamines, and also methylcobalamin. So the dosage right now, I use about 50 milligrams a day, okay? The next questions, in my experience, how many doses for plant stanol and steroid and for how long to reduce LDL? The dosage usually 2 grams per day. 1 bottle of supplements give you about 2 grams of plant stanol. How long you have to take it? Forever, because the effect will show after 2 weeks. But if you stop, the LDL cholesterol will bounce back within a week. So you need to take it every day, okay? Because the effect will show. 1 week it shows, 2nd week is steady. You don't need to take more than 2 grams because it cannot reduce the cholesterol in your blood come from the liver make it. Liver make cholesterol, has nothing to do with the gut. So the maximum decreasing, okay, percentage that you can decrease for plant stanol is 15%. Top is 18%. You cannot go over. So go beyond 2 grams, not gonna help you LDL cholesterol further. So 2 grams of plant stanol is good enough. The next, the last questions. How many doses of vitamin K2 do I recommend and for how long to prevent calcifications? In my experience, I haven't had any patient who have less calcification, you know, test the first calcium score and after I repeat it getting less. So if it remains the same, I'm happy. The dosage for prevention, someone like me, who my calcium score as old as me still zero. I don't have calcify heart, 0. So I take vitamin K in terms of we call microgram level, okay, 100 micrograms per day. But in patients who already have calcification, thick calcification, I don't use microgram level anymore. I use 5 milligrams a day. It's sold as a drug from Japan called K in Thailand. Okay, I don't know about your country, but yes, for preventions, my plaque, no plaque like me, I use only 100 microgram to 500 microgram, but super plaque has to be 5 milligrams, different level of vitamin K2, and don't forget natto and natto. Okay, how long your patients take digestive enzyme? Oh, actually, I take forever. But to me, I take digestive enzyme maybe 3 times a week. The problem for me, when I take digestive enzyme, you see the large molecule became small molecule, it's whole water. So it means the next day I go to toilet better. I cannot take digestive enzyme when I travel because sometimes it's not, it's inconvenient to go to the toilet too often. So you can take digestive enzyme for life without any side effect at all if you choose the right one. As well, you can take vitamin K2 for life. Is plant stanol Medicare? I don't think so. I don't know about your Medicare system in Indonesia, but it's supplemented and Medicare entire world never support supplements. Okay, so it's part of they've switched it to functional food. Go to your supermarket, not drugstore. You don't find plant stanol in drugstore. You find in the supermarket. The brand is called Benecol. Okay, you can use a Benecol butter, Benecol juice, Benecol yogurt. But of course, if you use steroid, it's a supplement, but it will not support by Medicare. Any brand digestive enzyme do you recommend? I know the international brand called Transformation, but if you come to Thailand, I have my own brand called Works. Works that works, the supplement that works. That's why we call Works. But if you find the international ones, you can purchase something called transformations. But if you contact heatantiaging.com and ask we have a small company called WRX Works. Okay, I'm not sure that's the website finished yet, but you can ask them about our digestive enzymes. Wow, that's it. A lot of questions today. Anyone want to ask me live? You can add, you can write, or you can speak up.
One more.
Okay, there's more questions coming. What? Too small.
Too small. Yeah.
Okay, people ask, when should we take probiotic and digestive enzyme? There's two ways. Okay, all right. I'm talking about probiotic first. Okay, some people say if you take probiotic with food, it lasts longer because you provide them with food. I take probiotic before bedtime. Why? Because I don't eat perfect food. So if they eat the one I show you, Greek salad, or I eat salad, eat vegetables, I will eat probiotic after meals. But if I eat dairy product, if I eat cheese, if I eat a lot of animal fat, or a lot of eggs, I would not put probiotics together with food. Bad food give bad food to our body and also bad food to your bacteria. The studies show if you eat probiotics with lecithin, it will produce something called TMAO that is toxic to the heart. You see? So if not sure that my food is good, I rather take probiotics with empty stomach. It helps me with the diarrhea. So it provides support for probiotics, but I would not mix probiotic with my bad food. But if I eat vegetables, I can eat probiotic with food. Okay, answer the first questions about probiotic. Timing to eat. The second is about digestive enzyme. People think that, oh, if a digestive enzyme, you have to take it after meal, right? Sometimes it's not, okay? If you want to help with the digestion, you can wait for 30 minutes before you take digestive enzyme. Why? Well, wait until your body digests something first, because you want to digest what? Protein, fat, carbohydrate, and let the part that it cannot be digested left in your GI system, and then you put digestive enzyme after, right? You want the body to do that job first, and then you add digestive enzyme later. So we wait a little bit before you take digestive enzyme. I take digestive enzyme before bedtime. Why? First reason, I wait for my body digest the food, and then I watch for the leftover undigested food, and then they pour digestive enzyme in. That's why my digestive enzyme cannot be interfered with some other stuff. And the second reason, I told you before, digestive enzymes, certain digestive enzymes, such as bromelain from pineapples, core, can be anti-inflammation. So I use it, okay, during this empty stomach. I use it as the anti-inflammation thing. It will digest inflammatory cytokines from your gut. Tried it, okay? You remember serratiopeptidase under the trade name of Danson? It's the enzyme that reduces face edema, inflammations in your face, you see? Or a lot of enzymes that reduce the symptoms of varicose vein. They are enzymes. You put it in the mouth and your varicose vein is getting better. So in that case, I would take it with empty stomach to relieve inflammation. Any questions more? All right, I think if you have more questions, feel free to write it down or can speak up. But right now, I answer all the questions.
Thank you very much, Doc. Anyone else going to ask Dr. Patana a question here? No? Everyone happy? Looks like everyone's happy, and we're going to see you in March, no?
Yes, in Bangkok.
In
if
Bangkok.
you miss the March, we still have August Congress, the big anti-aging Congress in Asia.
Yep, yeah, I know. That is that is full of show and always full. And the participants is getting more and more each year. The last
Yes.
time I was there is about what 600 people.
Yes. Yes.
Yeah.
Good
Yep.
show, good food, Dr. Patana's guarantee.
Yeah.
And good knowledge too.
Yep. Okay, so it looks like everyone's give a comment saying happy too. So thank you very much, Dr. Patana.
Yes. Thank you so much for listening. I enjoy every moment of it. Okay.
Yep.
I see
Have
you
a
in
good
my
weekend.
Okay. You too. Bye.
Bye. Okay, so
Okay, so should we take photos? Dr. Pradana already gone? Left. Okay.
it's okay. We had
Okay.
it yesterday.
Should we take another photo or maybe next week on the last session?
The last one. Yeah.
Last one. Okay. Okay, so we're done for today.
Yep. See you all again next week.
Thank you all.
Bye.
Thank you very much. See you next week. Bye.
Next week.
Bye-bye.